Good morning. Kuan-Pin, thank you for your accepting my invitation and joining our project. It is a pleasure to see you and hear from you. We have published and had lectures together. I believe that this interview will be yet another activity and will get acquainted Polish doctor who is your work. Project Psychiatry after Diploma is set to create an international exchange of professional information in psychiatry and psychology. You have been working for a long time on the impact of nutrition on psychiatric disorder, especially in depression. Please tell us a bit about critical periods in human nutrition that might severely influence the risk of depressive disorder.
Nice to meet you as well, Piotr. Let me put it into three labels of critical periods to explain the importance of human nutrition in the risk of brain disorders, with the example of omega-3 fatty acid in depression. So, firstly, from the evolutionary perspective, the excess of shore-based diet high in omega-3 fatty acid had a key role to increase the brain-body mass ratio, also known as encephalization, which makes a critical difference in survival and reproductive success when chimpanzee evolved it to human about 2 million years ago. And the second label is the whole generations of read deficit. As the modernization progresses, the interplay between brain and omega-3 diet is ongoing. And for over the past hundreds of years, our diet has dramatically shifted from high anti-inflammatory omega-3 to high pro-inflammatory omega-6 and also saturated fatty acid. And this shift is used to explain the dramatic increase incidence of many inflammation-related chronic medical illness, including obesity, cardiovascular disease, metabolic disorders, and depression. And the third label is actually the specific populations of omega-3 deficit. For example, in order to provide essential omega-3 fatty acid to the fetus and the newborn babies for the development of brain. So women during pregnancy and breastfeeding tend to have an omega-3 deficit. And we published the first meta-analysis to demonstrate that omega-3 deficit were associated with high risk of perinatal depression. In addition, we also published the first double-blind placebo-controlled study to confirm the antidepressant efficacy of omega-3 in perinatal women. So the results have been replicated by independent groups. And recently, our collaboration with two Japanese groups also revealed a trend of preventing perinatal depression with omega-3 fatty acid. So following perinatal to early childhood periods, my colleagues Dr. Jian Zhang and I also have been working on ADHD children and parents for many years. And our reports show that low omega-3 intake and essential fatty acid deficit were associated with more ADHD symptoms and cognitive impairments. We also found that omega-3 fatty acids, including DHA and EPA, were effective in treating inattention symptoms.
Very interesting, thank you. You devote lots of your publication to omega fatty acid supplementation among children, adults, and pregnant women. Why do you see it is as so important for psychiatric perspective?
Well, as we know that drug treatment and medication for major depression in pregnant women and children are still clinical dilemma. And today, the US FDA or EU agency approved no psychotropic drugs during pregnancy and even issues a black box warning of suicidal risk of antidepressant in children. And we know that omega-3 fatty acids are important nutrients for pregnant women and young brain, as I mentioned previously. So far, there's two double-blind placebo-control have been trials have been conducted to investigate omega-3's therapeutic effect in pregnant women with major depressive disorder. And there's also two small RCT randomized control trial reviewed omega-3's antidepressant effects in children. And some critical clinicians might argue that the RCT for pregnant women or children are limited by small sample size and some inconsistent conclusion. But I do agree that we need more supportive evidence from more RCT. But I also believe that the opinion leaders have the responsibility to provide more comprehensive treatment and alternative non-pharmacological treatment on less touched area by pharmaceutical companies, such as the non-drug treatments for pregnant women and children.
Great, thank you. Let's talk a bit about vitamin D3 then. Research in European population show that most of us suffer from vitamin D3 deficiency. How do you see the possibility of constant supplementation of this vitamin? In what disorder does it play key role in your opinion?
Okay, vitamin D deficiency is not uncommon now all over the world. People thought that it might be less severe in people who live in low latitude countries like Taiwan. However, our national survey showed that more than 90% of Taiwanese are actually in a deficient status. And the deficiency of various vitamins, not only vitamin D, could lead to many forms of psychopathology, say vitamin D9, folate, and SAMe for depression, vitamin B12 for dementia, B1 for Wernicke-Korsakoff syndrome, and D, of course, for depression, schizophrenia, dementia, and vitamin C for anti-inflammation and anti-oxidation. And we all know vitamin E for dementia and anti-oxidation, and vitamin A for dementia and neurodegenerations. But I don't think we need to recommend everyone to for constant supplementations of any kind of vitamins. However, I think we should measure the broad labels of vitamin status in all the psychiatric patients who develop treatment resistance. And I do have significant experiences that a patient improved dramatically after the deficient status were corrected.
Thank you. You also write a lot about neuroimmunology. Why do you see neuroimmunological processes as so important? Do you see any possible therapeutic intervention in this area?
Yes, I think existing theories based on monoamine neurotransmitter in psychiatric disorder actually fail to explain obvious clinical observations, such as, for example, high treatment resistant rates with current pharmacological treatment, and also the high comorbidity of somatic symptoms and physical illness in depression. And increasing evidence suggests that immune and inflammation response play an important role in neuropsychopathology of depression. For example, depressed patients have been found to have higher levels of pro-inflammatory biomarkers. And the powerful evidence is that a therapeutic administration of interferon alpha can lead to major depression in patients with chronic hepatitis C viral infection. In fact, pro-inflammatory cytokines have been found interact with many psychophysiology characterizing depression, including neurotransmitter, neuroendocrine, and also synaptic plasticity. The neuroimmunity theory also provides an explanation to the fact that there's a high comorbidity of somatic symptoms and physical illness in depression. And also immunological process certainly provide promising therapeutic intervention for depression. So chronic inflammation involved in the etiology of, for example, heart disease, stroke, cancer, metabolic syndrome, as well as major depression. And we have previously demonstrated that low omega-3 fatty acid levels are associated with higher pro-inflammatory status and also increase the risk of developing interferon alpha-induced depression. And we also apply double-blind placebo-controlled study to prove that omega-3 fatty acid can prevent inflammation related, in this case, interferon alpha-induced depression. So we think the endogenous or exogenous anti-inflammatory agents could be very important for depression, especially for those who develop depression in inflammatory context.
That was very insightful. Thank you. I have read your article using psychoneuroimmunology against COVID-19 with a lot of interest. Could you please explain this to our viewers?
Sure. The worldwide outbreak of COVID-19 indeed raises concerns of widespread panic and anxiety in individuals subjected to the real or perceived threat of the virus. And compared to the general populations, patients who are institutionalized in a closed unit are also very vulnerable to COVID-19 infection and the neurological complications. And this crisis indeed touched on a difficult issue of not only psychiatric care and ethics, but also psychological impacts to psychiatric caregivers. And in my article, using psychoneuroimmunity against COVID-19, we addressed both physical and biopsychosocial aspects of the infection, as well as psychoneuroimmunity of preventive strategy of healthy lifestyle, regular exercise, balanced nutrition, quality sleep, and a strong connection with people. And we know social distancing and wearing masks might help us from pathogen exposure, the virus exposure. Yet, such measures also prevent us from expressing compassion and friendliness. Therefore, all forms of psychological support should be routinely implemented, not only to consider psychological resilience, but also to enhance psychoneuroimmunity against COVID-19.
I see. Thank you. Let's talk about pandemia then. In Poland, we have faced many restrictions, but now the situation is changing. Please tell us how is the situation in Taiwan?
Okay, I'm delighted to know that the situation in Poland is getting better now. However, we also read some worrisome epidemic news from, for example, the United States, India, and many other countries. And the numbers of infected patients are still increasing. And also many physicians are in a very difficult and stressful condition. And fortunately, we in Taiwan uh, preparing several steps ahead the worldwide outbreak because we actually have very early detection and already very early uh, strategy. So in last December, we already received alert message from Chinese physician visitors, and we also reported to the WHO the early evidence about the pneumonia from Wuhan. But the WHO don't recognize Taiwan because China's influence. So we then, in Taiwan, control our own border, setting the, for example, the price of masks, and use the government funds and military personnel to increase the production of masks very early. And we leverage our national health insurance database and integrated it into the migration and customs database to begin the creation of big data for analysis. So as early as January 5th in 2020, notification was expanded to include any individual who had traveled from outside countries in the past 14 days. And surely, according to recent paper in Taiwan is recognized as an example of how a society can respond quickly to a crisis and protect the interest of its citizens. And as you know that the WHO didn't declare the global pandemic until March, but it's actually too late, almost 2 months late. And I think such delay now proved to be a disaster, and it caused huge cost of human life. But I really hope that the pandemic will be subside soon, and I can visit my dear friends in Poland as soon as possible.
Thank you very much, Kuan-Pin. It was my pleasure to talk to you. Thank you for sharing your opinions with us. It was very valuable, and I hope for the future possibilities for us to talk. Goodbye.
Thank you very much, Piotr.